Assalamu alaikum. I am here from Conceptual Medicos, and today in this lecture we will be talking about the anti-anginal drugs. So first we should know about the angina. Angina is a severe chest pain which occur due to the decreased oxygen supply to the heart muscles. It is a symptom of the ischemic heart disease which may lead to myocardial infarctions when not treated. There are three types of angina. The first one is the stable angina. It is also known as classical angina or exertional angina. It occurs when the person does some exercise or climbs the stairs. So it occurs due to the low blood supply, low oxygen supply to the heart muscles because the vessels may be narrowed by some atherosclerosis and there may not be proper perfusion to those heart muscles. The second one is the unstable angina. In unstable angina, the person feels the chest pain while at rest. It occurs because of the thrombotic events in the coronary vessels. The third one is the Prinzmetal's angina, which is also known as vasospastic angina. It occurs due to the vasospasm of the coronary vessels. The coronary vessels become narrowed and there is no proper ventilation to those heart muscles. Coming to the pathophysiology of the angina, so it occurs due to two basic mechanisms. The first one is the decreased oxygen supply to the heart muscle, and the second one is the increased oxygen demand of the heart muscles. Okay, decreased oxygen supply may be due to atherosclerosis or may be due to vasospasm, and increased oxygen demand may be increase of the heart rate, increasing the contractility, etc. Now for the management and treatment, we have to focus on two things. First, we have to increase the oxygen supply, and second, we have to decrease the oxygen demand. For increasing oxygen supply, first we have to restore the blood flow to the heart, and this can be done by percutaneous capillary intervention, in which we put a stent inside the capillary to restore the blood flow, or coronary artery bypass graft. The second one is to decrease the vasospasm. If there is any vasospasm which diminish the blood flow to the heart muscles, we will treat this by certain drugs like calcium channel blockers and nitrates. The third one is to break the thrombi by thrombolytics like streptokinase. The second one is to decrease the oxygen demand. We can do this by decreasing the heart rate, and we know the drugs which decreases the heart rate are beta blockers, etc. The second one is to decrease the preload, means if we dilate the veins it will cause decrease in the preload, and this can be done by the nitrate, etc. The second one is to decrease the afterload so that the heart may not work so much and the oxygen demand become decreased, and it can be done by calcium channel blockers. Now coming towards the classification of the anti-anginal drugs, so it can be classified into five types. The first one is the nitrates, second one are the beta blockers, calcium channel blockers, potassium channel openers, and others, which include statins and other antiplatelets drugs. So coming to the first one, which are nitrates. So there are many, but three are important. The first one is nitroglycerin, also known as glyceryl trinitrate. Second one is isosorbide mononitrate and isosorbide dinitrate. These three are used most frequently. The mechanism of action is very simple. These nitrates, when enter into the cells, they releases the nitric oxide. This nitric oxide level, when increased in the cell, they stimulate guanyl cyclase enzyme, and this enzyme converts the GTP into cyclic GMP. When the levels of the cyclic GMP are increased, it will activate the enzyme phosphokinase G. This phosphokinase activate the this phosphokinase basically activate the phosphorylation. This phosphokinase G will activate the phosphatase enzyme. This phosphatase will dephosphorylate the myosin light chain kinases. So there will be a relaxation of the vessels. Okay. Now coming towards the pharmacokinetics, so we should know 3 or 4 points about the pharmacokinetics, that they are readily absorbed from the oral and sublingual routes. There is extensive first pass metabolism. You should remember that they accept isosorbide mononitrate, which is less which has less first pass metabolism. The sublingual route is a very fast acting route, and it can be the drug can be given sublingually, and its onset of action is in 2 to 5 minutes. The transdermal patch can be used for prophylaxis and prolonged uses. Coming to the adverse effects, so as we know that these drugs will cause vasodilation through mediation, so these will cause headache. As we know that vasodilation causes headache, as we can see in the migraine also. Due to vasodilation, there will be flushing. Due to vasodilation, there will be reflex tachycardia, and this can be prevented by giving the drug along with the beta blockers. Next one will be postural hypotension. The overdosage may cause methemoglobinemia. Okay, very important point here, that tolerance developed to nitrates. So to avoid this tolerance, we should give nitrate free interval of 8 to 12 hours at least. Okay, coming towards the three drugs, the first one is the isosorbide dinitrate. So it can be given sublingually in acute attacks, and it can be given orally in chronic prophylaxis. The next one is isosorbide mononitrate. It is better for the prophylaxis because it is longer acting, and it is orally very good because it doesn't go through first pass metabolism. Okay, the third one is the nitroglycerin or glyceryl trinitrate. So 0.5 mg sublingual is given in acute attack, but when the chest pain relieves and the patient feels better, he should spit the tablet so that to avoid the side effects. Okay, it can be given sublingually before exercise and stress for prophylaxis of angina. The patch may be given, which is longer acting, up to 24 hours.